السلام عليكم. اعتقد النهارده على ثالث يوم ابتدت فكره الايفيدنس بيز ميديسن تتبلور معانا شويه. زي ما قلنا سريعا ان there are steps for practicing evidence based medicine. اول step for practice is to assess your patient. You have a patient and you have to take full history and to do clinical examination, either general or local or abdominal or whatever examination. Then you determine the patient complaint and the need for evidence-based data about the patient condition. After assessing of the patient, you have questions in mind. This question usually revolves around what is the best diagnostic modality, what is the best treatment, what is the prognosis of this condition, what are the harms that may affect this patient. So these four domains are the major domains that you will need an answer for: diagnosis, treatment, harm, and the prognosis. So you start to formulate questions, and these questions has a specific format or a structure which is known as the PICO format. What is the patient problem? What are the interventions that you might ask about? Is there any comparison intervention? And what are the outcomes that you are looking for? By formulating a PICO question, you start your searching for evidence. So the next step is to try to acquire the best evidence. And acquiring the best evidence needs that you know well what are the evidence-based medicine resources that I have to search at to reach the evidence. These resources are two types of resources. You may go for a ready-made evidence or an already appraised evidence in resources of secondary research like systematic reviews and meta-analysis or even clinical practice guidelines. And there are many resources for the secondary research that already generated evidence, like the Cochrane Library, clinical evidence, up-to-date clinical guidelines websites, and then you start to search for the evidence for your patients. Or you may go to primary research when there is lack of evidence from secondary research. The most famous website that we search at is the PubMed or the Midline Library, and in the Midline Library or the PubMed we find primary research. Secondary research may be cited also in the PubMed or the Midline Library. When you find primary research, this research has not been critically appraised yet. So you cannot depend on the results of this research directly. You have to work up your mind and do critical appraisal. Is this research up to the standard so that I can trust its result and follow it? Or it has some sort of problems in the methodology? Okay? After critically appraising the evidence, which is the fourth step in practicing evidence-based medicine, you can apply the evidence to your patient care. So this is how it goes. Examine the patient, formulate a question, search for evidence, appraise the evidence, and apply the evidence. The question is known as PICO or PICO question. We cite the patient problem. What is the intervention or the exposure we would like to have evidence for? Compare this intervention with other interventions if it is possible. And finally, specify the outcome that you are looking for. And in the outcome, we usually look for patient-oriented outcome that matters. An end outcome. If a patient have high cholesterol, what is the outcome that we look for? To decrease cholesterol level or to prevent myocardial infarction? The aim is to prevent myocardial infarction. So this is called an end outcome or a patient outcome that matters. This is what matters to the patient. The patient doesn't bother himself about the cholesterol level, but he doesn't want to have a myocardial infarction. If we are looking for osteoporosis, what is the outcome? To increase the bone mineral density or to prevent fractures? So this is the patient outcome that matters. So we usually look for research that addressed end outcomes or patient outcomes that matters. These surrogate outcomes or intermediate outcomes are of little value for us in clinical practice. We have two types of questions, either a background question or a foreground question. The background question asks about the pathology, the pathophysiology, the etiology of the disease, the mode of spread of certain diseases, etc., etc. Where can we find answers for background questions? In textbooks, exactly. So background question answers are found in textbooks. And they are very important for us as students, but as a clinicians, they have a secondary importance after the foreground questions. When we come to foreground questions, these are the PICO questions that we generate that ask about what is the best diagnosis or diagnostic modality, what is the best treatment, what are the harms, what are the prognosis. So we find foreground questions in evidence-based medicine websites that address primary and secondary research. We have seen this slide before many times, the evidence pyramid, and we now know by heart that systematic reviews and meta-analysis of published research comes on the top of the evidence pyramid. So if you have a recent systematic review and meta-analysis, especially if this systematic review or meta-analysis has been published in the Cochrane Library, this is the best evidence that you can find. If there is no secondary research in the form of systematic review and meta-analysis, you have to go down to the pyramid to search for primary research in therapy, search for randomized controlled double-blind studies. If you have a question about harm or prognosis, cohort studies is what you have to look for. If you have a question about etiology or risk factors, case control studies is what you have to look for. If you have a question that you didn't find other types of studies for it, so search for case series or case reports. If you don't find any research about your problem or your question, here you can ask expert opinions or search for opinions of respected authorities, such as the Royal College of Family Physicians, for example, or the American College of Family Physicians, I mean, or the Royal College of General Practitioners, for example. They publish guidelines for family physicians to follow. Evidence is graded according to its power. The best evidence is obtained from systematic reviews and the meta-analysis of well-conducted randomized controlled trials, or even from very large multi-center randomized controlled trials. Here we say that the evidence is level 1. So level 1 evidence is the highest evidence that can be found. It is usually generated from randomized controlled studies. Down the pyramid we have the observational studies, the cohort and the case control. So level 2 evidence is systematic reviews of well-conducted observational studies or very large observational studies. The level 3 now, as you expect, comes from level 1 from experimental studies, level 2 from observational studies, so level 3 from descriptive studies. So systematic reviews of descriptive studies or very large descriptive studies. And what is the level 4 now? Down the pyramid. Remember the pyramid. Yes, it is the opinion of respected authorities. Okay? So you are going to have many classifications of the levels of evidence. Either 1, 2, 3, 4 written in Roman like this, 1, 2, 3, 4, 5, 1A, 1B, 2A, 2B, 1A, 1B, 1C, but collectively, this is the hierarchy of the level of evidence. The best evidence from randomized controlled studies and their systematic reviews. Observational studies come next and their systematic reviews. Descriptive studies come next and their systematic reviews. And finally, opinion of respected authorities. You have to put in mind that published research is never perfect. Every piece of research has some pitfalls. So there is no perfect study. The ideal study has not been performed yet. But you have to find the best. Prestigious journals or authors are never a seal of guarantee of quality. Don't be fooled by the big names. Big names have to be respected, but they are not a seal of guarantee. You have to critically appraise the published research by yourself. The problem is that, yes, there is even a critical reviews, critical appraisal forms for systematic reviews. But we can say confidently that the highest quality systematic reviews are those of the Cochrane Library. A badly conducted or biased research is hazardous to one's practice and to patients, as much as a good one is useful to them. If you have a biased research and the result is wrong, and you apply this result in your practice, this is very dangerous. And that's why we have to do critical appraisal. And in clinical evidence, you can find this slide. This is the effects of 2,500 of the most commonly used drugs. And what did they find? They found that 13% of the drugs that we use in practice are beneficial. And 23% of the drugs that we use in practice are likely to be beneficial. And 8% of the drugs has some form of trade-off between harm and benefit. They might harm the patient and they might benefit the patient. And you have to work up your mind before prescribing them. And 6% of the drugs that we use are unlikely to be beneficial. Probably they will not benefit the patient. And 4% are likely to be harmful. They are going to harm the patient. And the surprise is that 46% of the drugs, or about half of the drugs, are of unknown effectiveness. There is no solid, high-quality research that supports its use. And this is why we need critical appraisal. Because most of the drugs that we use in practice have not adequately studied yet. And we have to do appraisal of the studies. Someone would ask me now, and what about the FDA approval? The FDA approval is a license to market the drug. Is a license to market the drug after very primitive studies done on ideal conditions to know the effectiveness of the drug and the major side effects in the ideal situation. But this drug has not been utilized on a larger scale on obese patients, on hypertensive patients, on diabetic patients, on patients with immunocompromised, on patients with and with and with and with. The drug is actually tested in clinical practice. And here we have to be careful. You have to study the drug that you are going to prescribe very well. What do you expect from it? What are the randomized controlled studies that has been done and published before I use this drug? And you have to be very careful in prescribing new drugs. So new drugs are not always welcomed. They are welcomed after proper study. But initially, you have to be wary about them. And I am going to ask you, if you or one of your parents, for example, you took him to a physician, and he was seriously ill, and he prescribed a drug to him. And then you ask the physician, are you sure, doctor, that this drug is very good for my parents? And he told you that, I'm sorry, this is the first time for me to use this drug. It's a new drug, and this is the first time, and there has been little research, and this research most probably says that it is good. How much confidence you are going to be in this drug? Okay? So your patient expects from you to treat him the same. To give him drugs that are that you are quite sure that they are the best for him or her. Okay? And look at this. This is a drug, propalsid, that has been used for many years for heartburn. And it turned out to be deadly drug. It leads to cardiac arrest, irregular heartbeats and cardiac arrest. And it has been withdrawn from the market after being marketed on a larger scale. This is another drug, the Vioxx. Heart attacks has been reported with the use of Vioxx, and that has been withdrawn from the market. This is anti-diabetic drug, Resolene. It has caused liver poisoning and deaths, and has been withdrawn from the market. Bicol, a drug for lowering cholesterol level. It has caused rhabdomyolysis. The myoglobin has precipitated in the renal tubules and led to renal failure, and has been withdrawn. What does this tell us? What do you think about these new drugs? With their launch, medical representatives go to your clinic and say that we have a new wonderful drug. It is very effective compared to so and so and so and so. And in studies, it produced the best effect ever. Okay? Then you use it in actual practice, you give it to a variety of patients, and you find that the drug is not so beneficial as you thought, or sometimes may be harmful, and sometimes lethal. So you have to be careful. You have to look for the evidence before using the drugs that we prescribe every day. And this is the value of systematic reviews. In 1986, Williamson revised 4,235 research articles published in 30 journals of the top journals in the world. Among them were the British Medical Journal, the Journal of the American Medical Association, the New England Journal of Medicine, and the Lancet. And he found that only 20% of the published articles meet the validity criteria. Validity means methodological quality. So only 20% published in the top journals met proper methodological quality. And in 2004, the same has been done by McKibben et al. But McKibben searched in 170 journals. So the quality of the journals now are less. And among more than 60,000 articles published in the year 2000, he found only 6.8% of high quality and clinically relevant. So you waste your time reading new research that's not suitable for your practice, that might be of poor methodological quality. And that's why now we look for research published in evidence-based medicine journal or a very well-conducted, high-quality research articles.